My name is Dina Burstein. I'm an assistant professor of medicine at the Tufts University School of Medicine and the HOPE, Healthy Outcomes from Positive Experiences project director. I'm thrilled to present a summary of our recent publication, Parental Stress Associated with Pandemic-Related Disruptions in Services for Children. We know that families in the United States experienced tremendous disruptions during the COVID-19 pandemic. In response to the pandemic, United States federal and local governments implemented quarantine policies leading to widespread closures and lack of access to childcare and other services. Previous studies conducted prior to the pandemic have shown that parental dissatisfaction with daycare is a significant predictor of parental stress. We sought to examine parental stress during the pandemic. In particular, we wanted to understand, one, if the level of stress due to the loss of childcare resources and disruptions in children's lives was different by demographic or socioeconomic factors. Two, to understand if the level of stress was different between men and women. And three, to determine whether or not caregivers' own experience of childhood abuse, stress-relieving activities during the pandemic, and perception of helping their children with schoolwork were co-stressors. The Measuring the Impact of Violence Against Children and Women During a Pandemic survey was a nationwide, multi-wave internet panel survey conducted by the American Academy of Pediatrics in collaboration with the Centers for Disease Control and Prevention, Prevent Child Abuse America, and the HOPE National Resource Center. This report used the results of survey responses from 2 waves of 3,000 U.S. caregivers of children under the age of 18 each, conducted in November 2020 and February of 2021. The primary exposure variable was the number of COVID disruptions children experienced since March of 2020. The 10 possible disruptions examined are listed on this slide. Survey respondents reported a mean of 2.65 disruptions in childcare arrangements, children's activities, or services. COVID-related stress varied significantly by the number of disruptions in services for children, caregivers' experience of ACEs, and recommended stress-relieving activities. Our analyses suggest that pandemic-related disruptions in children's lives are associated with increased stress and anxiety among parents and caregivers. Sex, education, marital status, and family income are all significant demographic and socioeconomic factors associated with parent stress during the pandemic. Women had significantly higher odds of feeling nervous or stressed when compared with men. Conversely, parents who disagreed with the statement, "Helping my child with their education, including remote schoolwork, has been very stressful and/or has resulted in increased tension at home," were less likely to feel nervous or stressed compared to those who neither agreed nor disagreed with the statement. In conclusion, pandemic-related disruptions in children's lives were significantly associated with caregiver stress. Women were more likely to feel stress than men. Education, marital status, and family income were also associated with parental stress. These data suggest that preparation for widespread disasters should recognize the effects of disruptions on children's lives on parental mental health. This should include resources for alternative childcare options, supports and supplies needed for children to successfully attend school remotely, as well as accessible and quality mental health services. Thank you.